Alright, so welcome to my YouTube channel, Elite Healthcare English. So this is a little bit about me. I'm Frank and I'm a nurse. Currently we are OET preliminary provider. I've also written OET before, so I can say I'm more knowledgeable in the exams criteria and the techniques that I can assist a lot of nurses especially and doctors as well in OET. So you are going to learn a lot on this channel. So if this is your first time, kindly subscribe. Okay, I'll give you my contact at the end of the presentation. We are going to look at OET writing chapters. Okay, so we have OET listening, reading, writing, and speaking. Today we are going to look at OET writing. 6 questions you must know in OET writing is very critical because it will give you an overview in the case notes when you have the case note in front of you during the exams. You have first 5 minutes to read, to go through all the OET writing. You go through all the OET case notes within the first 5 minutes. Then 40 minutes to start writing. Use the second 5 minutes to answer these 6 questions you are going to learn. Then the third 5 minutes use to plan your letter and you start to write. Okay, so why are these 6 questions important and what are they? First of all, let's go through the content, what you are going to learn. So you are going to learn what the 6 questions are. I call it 6 skills. Okay, why are the 6 skills important? Then we are also going to use OET official nursing sample test 3, Jake Peterson, to analyze, okay, to get an overview of the case note for you to see how relevant the 6 questions are. Okay, so after going through, you are going to answer them. Then we will summarize from the answers. We are going to summarize to get an overview or the whole idea in the case notes. This is definitely not going to be the first and last, presentation on this channel. So I'll tell you the next topic, what you're going to learn after this presentation, and what you need to know to stay updated whenever a presentation of such is updated in the channel. So let's get started. Within 5 minutes we'll be done. 15 minutes, sorry, within 15 minutes we'll be done. So what are the 6 skills, the 6 questions? First, after reading through within 5 minutes, ask yourself, who is the patient? What is the purpose of the letter? Is it urgent? Who is the reader? Does the reader know the patient? What is the context? And when I say context, I mean the current situation necessitating for the purpose of the letter. Okay, not just current situation, but the current situation that is requiring you to write for the purpose of the letter. That is what you need to write. Alright, let's move on. So why are these questions necessary? Why are they important? So who is the patient? Okay, we are going to look at their purposes. We're going to look at the purpose, the 6 questions. I call it 6 skill. Okay, the 6 skill in their purposes. So if you're defining who the patient is, okay, it involves the name, date of birth or age, diagnosis, date of admission, place of admission, and then reason for admission. If the patient presented by himself or whatever, yeah, you can just be flexible, and then so date of what, presentation, place of presentation, reason of presentation. So why do we have to know who the patient is? Yes, to introduce the patient appropriately to the reader. You need to introduce the patient appropriately, and this question will help you to introduce the patient appropriately to the reader. The next, what is the purpose of the letter? It is central. It is central to the whole of this question, because if you don't know why you are writing to, how can you write? And even what are you going to write? So what is the purpose of the letter is very, very important. To know why you are writing, it will also help you to introduce the patient to the reader appropriately. It will help in selecting the needed information for the reader. Yes, so in the writing criteria we have content, and for you to select the needed information, you need to know what the purpose is. Very critical, very important. Is it urgent? You need to find out what evidence that shows that it is urgent. If there's none, it's fine. Okay, so to help in structuring the paragraph appropriately, if there's an emergency, if it is urgent or emergent, okay, you will know how you organize your paragraph. Definitely you will want to talk about the current situations before old stuff. Okay, yeah. Then who is the reader? To know whom you are writing to. It will help you to know whom you are writing to. It will help in selecting the needed and appropriate case note or information in the case note for the content and conciseness and clarity of the letter. So conciseness and clarity is also a writing criteria. Okay, knowing who the reader is will help you to focus and select the important informations. Okay, together with the purpose, you are going to select the important of it, and when you do that, it will help your work to be concise and clear. Okay, all right. Then, does he know the patient? It will help in selecting the needed and appropriate information for the reader. Yes. If, let's say, he knows the patient, certain information in the case note might not be needed because the reader is already aware. All right. For example, a patient who is a client, who's already a client of the reader. Okay, and he has a past medical history, where he lives, children. You know, do you think you need to include those things, those informations? No, because he already know who the patient is. So that's what it means. Does he know the patient? That's what it answers. So it will help you to select the needed and appropriate information. Last one. What is the context? Actually, the numbering. This is the sixth one. Okay, this is the sixth one. So to help to introduce the patient to the reader, yes, you want to tell the reader in your first paragraph maybe what is at stake, together with the purpose. Either in the first or second paragraph is fine. Okay, so you can use it, to introduce the patient appropriately. But when you're introducing the patient, the purpose of the letter is key. Okay, so you can combine who is the patient, what the purpose of the letter, and then the context. Okay, in 2 paragraphs to write your letter, or who the patient is and the purpose of the letter. You can mix it up anyhow you want to do it. Maybe in the next topic we'll look at how you can introduce the patient appropriately. All right, so let's continue. It also form basis of your recommendation. Yeah, so if you know what the patient condition is, the patient current situation, it will help you to select information that are needed. You have to select information that are needed for the reader to do. Okay, so it's also important. So can you remember these questions? Who is the patient? What's the purpose of the letter? Is it urgent? Who is the reader? Does he know the patient? What's the content? Well, I have an acronym for you. Okay. Patient purpose. Urgency requires knowledge of context. Patient is who is the patient? Purpose is what is the purpose of the letter? Urgently is it urgent? Requires is who is the reader? And then knowledge is does the reader know the patient? And context, what is the context? So you can use this one as an acronym to remember the 6 questions. I hope that helps. Okay, let's move on. So this is an OET official nursing sample test from OET.com. Okay, so we are going to use the 6 questions to answer in the second 5 minutes. Okay, in the second 5 minutes of your time during the exam. So first 5 minutes is reading time. No pens, no pencil. Just fold your arms on the desk. All right, to prevent malpractice. Okay, then after the 5 minutes, you now have your pen or pencil to underline those questions. Who the patient is, what's the purpose, does he know the patient? Those questions, just underline them, or you can write it somewhere. Okay, then all right, so the third one you used to plan your letter, but we are using the second 5 minutes to answer the 6 questions. Now let's see how we did it. Okay, who is the patient? Jake Peterson, that's his name. Date of birth 17 March 2001, 18 years. Date of presentation March 2014. Place of presentation school clinic. Reason for presentation hair loss in patches and anxiety. Alright, the purpose of the letter to monitor and organize special exams arrangement. Is it urgent? No, there was no evidence in the case that shows that it's urgent, so it is no. Who is the reader? Mrs. Callan, a university practice nurse. Does he or does the reader know the patient? No, she is seeing him for the first time. All right, what is the context? Jake Peterson is concerned about his transition to university shortly and independent living. So I can combine who is the patient, okay, the context and the purpose of the letter to write a 2-sentence introduction. Okay, right. Well, now so let's see how. Now this one has given you an overview of what the case note is about. Okay, let's put everything together. All right, So from the questions, these are the information I gathered, and we've put them together here. So Jake Peterson, born on March 17, 2001, is an 18-year-old student who presented to his school clinic in March 2014 due to hair loss in patches and anxiety. Jake Peterson is concerned about his transition to university shortly and independent living. Mrs. Conlan, a university practice nurse, is seeing Jake Peterson for the first time to monitor and organize special exams and remember him. This case is not considered urgent. This has given the whole picture of the case notes. How amazing. Alright, so you've answered the 6 questions, and now we have a pictorial overview of the whole case note. Now you want to plan your letter. You want to select the case notes. How do we do it? The 6 questions will definitely help you because we've known the purpose of each question. So if you want to select the information in the case notes, which question do you have to rely on? Okay, I know you have the answer. Alright, so next topic, we are going to select the information in the case notes. Okay, so all you need to do is to subscribe, share. At least you should have a lot of subscribers. Okay, they want everyone to succeed in OET in just a setting. If you need help, contact early